Good morning, everyone. My name is Monica, and as a clinical program manager at InBody USA, I want to welcome all of you to today's webinar in our InBody Present series. Today, Mr. Travis Combest will be speaking to us about different methods of body composition. Travis is from the Washington, D.C. area. He enjoys spending time with his family, weight training, camping, and being outdoors. He has been an exercise physiologist for over 15 years at Walter Reed National Military in Bethesda. He is certified from the American College of Sports Medicine as a registered clinical exercise physiologist, and he is currently a PhD candidate in Health and Human Performance from Concordia University of Chicago, and a Master's of Public Health. He's working on a dissertation on a comparison of body composition methods. He enjoys motivating and designing exercise for participants and helping people live healthy lifestyles. During the talk, as well as after, attendees will have a chance to ask him questions by adding them to the Q&A section on your screen. So without further ado, I'd like to welcome our guest speaker, Mr. Combest, to join us.
Thank you, Monica, and welcome everyone for today's presentation on a comparison of body composition methods. We hope that you will take away all of these insights and apply it to your practice. Once again, I'm an exercise physiologist at Walter Reed National Military Medical Center, and I just want to give a disclaimer that the views expressed in this presentation are those of the author and do not reflect the official policy of the Department of Defense or the U.S. government. And let's go over some of the learning objectives that we're going to look at today. And we're going to go over like a brief review of some of the body composition measures that are currently in the literature and in the clinical atmosphere. We're going to also look at a client experience, and that will help us look at not only some of the body composition methods, but give us a good practical insight into how body composition is measured. We'll also look at the clinician experience on how different assessments or objective viewpoints can be interjected with the patient's plan. We're going to look at a comparison of body composition methods with some research. We're going to look at the future directions, the impact of hydration, exercise, and measurements. Also, we're going to look at some of the practical applications when you're presenting the results to your clients. Now, why do we do body composition? You might ask some of these questions. Well, if you look at some of the risk factors for some of your patients and for the population at whole, one of the strongest risk factors for developing type 2 diabetes is excessive adiposity, which just means especially the extra weight in the trunk area or the waist area. A study by Rav et al. Showed that heat stress in those who were exercised in the heat, 71% of those were in the low fitness area, and 64.7% were overweight. Also, keep in mind that losing body fat is difficult. We may know this from experience or from our clients' experiences, and it's a slow process. So measuring improvements over time can help motivate, and it can help plan your program design. Now, if we look at some of the body composition techniques, for example, one of them is a dual energy X-ray absorptiometry, which is acronym is DEXA. Now, I did a diagram here that just basically shows you a visual image where there's a scanning area and it scans in each direction. Now, this scan is very helpful for a number of reasons. But I want to first mention that this is used in the National Health and Nutrition Examination Survey called NHANES. And it has 3 components, which includes bone mineral content, lean muscle mass, and fat mass. Now, some of the limits increased, it's hard to move around, and the increased cost or weight of the DEXA scan. There's also the expense, and you're exposed to low-grade radiation and the size of the scanning area. And this may be practical in research centers and clinical centers. It may be for some research studies or used for different surveys. But keep in mind, right now, currently, it's considered to be the gold standards which other body composition methods are measured against. And let's take a look at the bioelectrical impedance analyzer. Now, today, I will be talking more about the newer models, and we'll describe a little bit on what those consist of. But let's just get a crude drawing here on what a bioelectrical impedance measurement tool might look like, where you have the different electrodes that measure, and this is a kind of a crude drawing as well. But when you look at that, it will basically look at hand to foot, and you have those different 8 points where your hand and your feet attached that you can measure bioelectrical impedance or your body fat. And once again, it's another 3-component model which measures fat mass, fat-free mass, and water mass. The other component that's really important, as some of the newer bioelectrical impedance analyzers, they'll do different frequencies. So they'll measure the body throughout in 5, 50, 250, 500, and 1,000 kilohertz. And that's helpful because it goes through the body and it's able to look at intracellular and extracellular water. Furthermore, some of the newer bioelectrical impedance measurements, they also look at what's called segmental analysis. And segmental analysis basically means your arms, your trunk, and your legs. That's similar to the DEXA, which also does segmental analysis. And you're able to look at the lean muscle once again in those different areas. You're also, some of the newer measurements, you're able to look at the visceral area. So that's basically in the organs where the deep visceral fat is, and you're able to look at a chart to be able to determine if you have increased risk for cardiovascular disease by having increased visceral fat. So those are some other good helpful points on some of the new bioelectrical impedance analyzers. And if we look at agreement that we mentioned, the DEXA further, an agreement, when you measure that, it's just basically how they agree to each other. And a perfect correlation or agreement is 1, and that would go together on a scale. And if we look at the bioelectrical impedance, which the acronym here is BIA and DEXA, for body fat percentage, when you compare them together using a measurement called the interclass correlation coefficient, was excellent, with the interclass correlation for females 0.93 and the interclass correlation for males 0.88. Now, those are the 2 methods that we'll primarily be talking about today. We will also talk about the circumference measurements, but you may have different body composition measurements that you have used in the past. For example, if you're going in for a physical for a sports team, if you came and measured your progress with a doctor. However, these are the ones that we are going to primarily talk about today and compare in different 3-component models. Now let's dive into this patient experience. And I'm really privileged to be able to work with different people on body composition. As Monica mentioned before, I've been doing this for over 15 years, and I really get excited when someone is wanting to work on their change. And when you look at body composition, it is an objective measurement, but it means a lot for a person because that means their health, their functional ability, or some of the things that they want to do in life. And I think that's important that if we can look at that and see how we can apply it to the measurement, that makes it even more valuable. So let's take a look at this patient. So Mrs. M came in and she was seen for weight loss management with an exercise physiologist and nutrition. She was referred by a primary care doctor. And during this pandemic, she decided to work on her weight loss. Now, for some folks, it may take a big life event for them to be able to work on behavior change. It doesn't necessarily have to be that case, but for Mrs. M, this was a really big point that she wanted to work on some of her health and lifestyle factors, and she really came to see us and was motivated to put those into action. Now, the client came to us and she used the body composition assessment, and it was helpful for her for a number of reasons. And she gave some starting points for food intake and basal metabolic rate, and she met with a dietitian as well. And when you look at this body composition, some people like, oh, I don't want to take a body composition, or they may be a little bit reluctant to take their body composition. And one thing that you can always say, or I believe that we do sometimes in the clinic, is mention it's a baseline. So it's a starting point, and it's a way that it doesn't judge you or put you to make you feel a certain way or labeling. It's just a point that this is where some of your habits or some of the plan that we're working on, how we can measure it and motivate you. So that's one thing that I just want to throw out there, that don't necessarily have it as a obstacle for doing things. Have it as something where you can refer to it as a baseline. And once again, we didn't touch on earlier, but some of the bioelectrical impedance analyzers, they will also have something called a basal metabolic rate. Now, for some of those that may not be aware of what basal metabolic rate means, that's just how much the body needs at rest to maintain function. And what's really neat with some of these new bioelectrical impedance measurements, they use one of the formulas, which is called the Cunningham equation, that will factor in your lean muscle mass into the equation, which makes it more accurate, and it will be able to be more sensitive. So some of the bioelectrical impedance measurements, it's good because it measures lean muscle, and you're able to put that into the calculation. And that's helpful for some of the weight loss programs, and was helpful for the dietitian. Once again, I mentioned that earlier, that we're able to get some other measurements like the visceral fat, basal metabolic rate, which we just talked about, and the decrease in body fat were important for the client. Especially in the beginning of the weight loss program, there's one thing that you can always do when you have certain assessments. You can look at making SMART goals. And basically that's an acronym. It just means specific, measurable, attainable, realistic, and time bound. So if somebody mentions, hey, I want to lose weight, well, let's look at making that specific. Okay, let's make it realistic. If we want to decrease, let's say 3 to 5 pounds in the next month, and we want to work on decreasing our body fat in 6 to 8 weeks. So that can go right along, the goals could go right along with this body composition assessment. Now, this particular client, still during this pandemic, was able to measure the body composition assessment every 3 months. Now let's look a little bit at Mrs. M's progress. So Mrs. M, once again, she was ready to go. She measured her body composition, and she performed exercise session 2 days a week with muscle conditioning. And then she did other walking 6 to 7 days a week. Now, 60 to 90 minutes may seem like a lot, but once again, she started with that first step or that first assessment. And she worked on doing that 30 minutes in the morning when she knew she could stick with it. And then every 3 to 4 weeks, she brought it up 15 minutes. So that's one of the things that you can look at with your patients is what you do, it does matter. And what you do, you can track it and you can make it something that you can see some of your progress. So that was helpful to her to not only see her physical activity program go along, but also to see some of her measurements decrease as well. Now, once again, during this time, we did the telehealth. So we were able to do some sessions via telehealth, which I think is a good option now, in addition with in-person visits. And if that's one of the areas that you can do with your clients to limit some of the obstacles, that's great as well. We were able to do that as well. And we also looked at muscle conditioning as another component that's important. In addition, doing the cardiovascular, which the American College of Sports Medicine recommends 300 minutes per week of aerobic activity to lose weight. The muscle conditioning is important as well, because on some of the bioelectrical impedance measurements or some of the other body composition measurements, you can be able to look at skeletal muscle or lean muscle. And that's important when you're losing weight, that you want to make sure that you maintain it. Because if you don't use it, you lose it. So that's something that's important as well to implement into the plan. Now, the other thing, surprisingly, she was able to make a lot of her meals. So she was really motivated during this time to cook and prepare her meals. And she was really motivated by some of the interactions with the dietitian. And she was able to lose 40 pounds. And she brought her visceral fat down from over the arranged, some of the bioelectrical impedance measurements have it in a certain range. She was able to bring it above normal to even below the baseline for a decreasing cardiovascular disease, below that baseline. Not only did her cholesterol decrease, measured by her labs by her physician, but her endurance. And so she mentioned for 15 minutes over time. So for her, not only the measurement to see how her body composition was changing, but she was with her husband at the lake, and she was able to get into the kayak by herself with the balance and be able to go the whole time. Whereas before, she would have a lot of people help her get into the kayak. And it was also a period of time that she may have to come back after a period of time because of her endurance. So her ability to be with her family, ability to have independence meant the world to her. And also some of the mobility, moving around. So we looked at that study before in terms of heat tolerance with extra weight. Being able to move better and having less weight on your joints was really important for her, that she could be able to get out and do more things. And so let's take a look at the clinician's note. So let's take a little bit of note in terms of what some observations were from some of the clinicians, notably myself and the dietitian. Number one, it's important to make the body composition assessment relatable and useful to the client. And that's something that, in addition to your assessment and you're providing the information to the person, find out from them why they want to lose weight loss and why would it be beneficial to them. So if you can relate it, you're going to be able to lose some body fat to decrease your cholesterol, increase your health, be able to get on that kayak. So the more that I was able to learn what kind of things she wanted and relate the loss of body fat and weight to that, it seemed to click. So to make it relatable and useful. Also, the ability to track the skeletal muscle, as we talked about before, when you're decreasing body fat, was very reassuring. So when you're doing some type like a muscle conditioning routine, it may be strenuous and you may think, well, I only want to do aerobic activity. But in addition to the weight loss plan, if you can do some muscle conditioning, you can maintain the lean muscle you have or increase it slightly and make sure that the weight that you're losing is body fat mass. So that was actually really important for her to be able to stay motivated to do the body composition. Because there were some points like, no, I'm not getting up at 8 a.m. to do the muscle conditioning. And if you have a really strong why, or you're able to measure that why, you can get up at 8 a.m. Because a lot of the obstacles that you may have, if you have a strong why, that kind of eliminates some of those obstacles. So that was really important for her. And that's one of the things that she noted that we talked about in terms of maintaining the muscle conditioning routine. Also, that ability to see the decrease in visceral fat and the decrease in cholesterol was really important, because that meant that she was not only improving her body fat, but her health in terms of decreased risk for cardiovascular disease. Also, the improvement with her cardiovascular endurance. So being able to, one of the things that I found in the clinic that people mention that they want to do is they want to keep up with their family or their grandkids or their friends, that you want to go on a hike or you have some kind of event. So you don't want to disclude yourself from living life to the fullest. So having less body fat, more mobility, you can live life to the fullest. Now let's dive into some of this research in the body composition methods to kind of reinforce some of the client and the clinician notes that we had in this particular case on comparison of body composition methods. So this was one study that actually I participated in, was an author with research in body composition methods, that we had 76 subjects, 31 males and 45 females, and they participated in the study and completed all 3 body fat measurements during a single visit. And this comparison did involve the bioelectrical impedance, DEXA, and circumference measurements. Now, as you can see, the ages were pretty similar. We're around in the 30s. The weight, the males were a little bit more than the females. The BMI, it was over 25, which meant they were in the overweight category. And we have some measurements of the neck, hip, and waist. The other thing is of note here that you'll look at is urine-specific gravity. That's another way just to measure hydration. So a subject or a patient can be able to use the bathroom, and you're able to look at the urine against the light, and you're able to look at how hydrated they are. In this particular case, they were hydrated with a 0.02. And we found that the agreement with the DEXA, once again, that agreement, if it's a perfect 1 for the bioelectrical impedance for females was 0.93, and for males was 0.89. And their circumference measurements with DEXA, which measured at those different sites, with DEXA, the interclass correlation for females was 0.83 and males was 0.72. Now, one consideration that we looked at in this particular study, there is consideration that possibly bioelectrical impedance can over or underestimate body fat as a result of hydration status. In this particular case, hydration was not found to be a significant confounder, which just means that a confounder would interfere with the results or affect the results in a certain way. The subjects were hydrated, which would suggest that if they're dehydrated, it may affect this bioelectrical impedance or DEXA agreement. And so I'm personally working on a dissertation for body composition measurements. And some of these things that we considered from our previous study that we are looking into are some of the things with validation studies to look at other variables or other things such as race, ethnicity, age, and the accuracy of these body composition measurements. As you can see in the study, that was the average age was 30. But what if we have different types of age groups, or in the particular case, we did not measure such things as race, ethnicity to look at that impact on body composition measurements, which would provide some interesting results. Also, some validation studies with newer bioelectrical impedance models than we used previously. Once again, this higher frequency of over 1,000 kilohertz is something that is still looked in the research, so adding more of those. And also the measurement of body composition after physical activity. And so if you have a client or a patient that you have report to body, get their body composition measurement, but there is a certain amount of things that they should not exercise before, keep their normal hydration, and maybe in some practical instances, they don't keep those lists of what they're supposed to do. So what is the case if somebody exercised in the morning and then they come to you for the body composition? So these are some questions that are important to answer when you're looking at the accuracy of body composition measurement. The other thing is, in terms of that, is Nickerson et al. Found that body fat percentage in total body water when using bioelectrical impedance measured at 40, 50, and 60 minutes post were similar to the beginning. However, if the measurement was taken prior to 40 minutes post, should we increase bioelectrical impedance body fat by 2.3%, or kind of like correction factor? Now we're looking at that as a secondary outcome in our proposed dissertation study, with looking at it a moderate exercise for 30 minutes, measuring it before exercise, moderate intensity, and then afterwards to see if that lines up with some of these results as a way to look at body composition measured after physical activity. Also, some of the practical implications. I think this is a good take-home message. If you think about it, it's really important to be realistic with patients. So even with vigorous workout plans or diets, usually expecting about a 1 to 2% body fat over 6 to 8 weeks is something to consider as part of your plan. And once again, using that SMART acronym: Furthermore, depending on the body composition method, there's usually an error of plus or minus 3%. After adjusting for body composition measurement, upward of 2.3% if the patient has exercised. This is 30 minutes moderate intense exercise, less than 40 minutes before the appointment. Once again, this is only one study. We have to look at some other things as well. We're going to be looking at this as well to look at some type of, keep that in mind. You might want to ask the patient or client if they have exercised before measuring their body composition, just looking to make sure you keep it as accurate as possible. In summary, clients and clinician viewpoints, they both matter. And it's important to weigh in on both of them and look at, once again, the kind of connection of we are doing the body composition measurement and you have certain goals that you have for their health, and then the client has different goals, and seeing a way that you can bridge that together to have it something where you make a change, not only in their body, their health, but how they feel and how they want to live their life. So we looked at a little bit about how some of the body composition measurements compare. We looked at a 3-component model with the DEXA and the bioelectrical impedance, and we weighed some of the pros and cons. And we also looked at some of the impact of hydration and physical activity, and maybe some more future directions that we can look at expanding with race, ethnicity, and looking at practical reasons in different age groups. Also, we did have a practical implication of the use of body composition measurements in terms of making it relatable and making it practical for the patient, and giving them time that when you have a follow-up appointment, maybe be realistic. So looking at, even with the exercise and nutrition plans, looking at 1 to 2%, as it looked in the literature, every 6 to 8 weeks for a follow-up or to measure that. And once again, looking at the whole platform of some of the bioelectrical impedance or DEXA or body composition measurements on how you can look at not only weight or body fat, but how you can look at other things such as visceral fat, such as lean muscle mass, and how it can relate to the program that the patient has. These are some of the references. Be glad to share them with you if you are interested. And at this time, I will turn it over to Monica, and we will have any questions that the audience or other members may have.
Thank you so much, Mr. Combest, for sharing the work you're doing, both in the clinic and in research. At this time, we would like to take some questions from the audience. As a reminder to all attendees, you can send in your questions to our speaker using the Q&A chat box at the bottom of your screen. So let's start with some of the questions we have here already. So, Mr. Combest, as you have shown an example of how you treated a patient in the clinic, is that a reflection of the current standard of care in your clinic? And if not, do you plan to make it the norm?
Yes, thank you, Monica. I think I will relate that for when you have a weight management plan, you want to make sure that you are, in the research we have found that with exercise, especially if it's one in the beginning, you want to make sure that those visits are a little bit more frequent so that they learn some of the exercise movements, for example, and how they can do it appropriately over a period of time. And also with making sure that you have regular follow-ups, at least 6 to 8 weeks to, as in the research, to be able to look at some of their changes in their body composition. And once again, when you look at some of the behavioral changes over time, it's good to look at especially making it something where somebody is going into the maintenance phase, which is usually over 6 months to a year. So having those regular appointments are really important, and making sure that they are making some of those lifestyle changes.
Very nice. So yeah, I like that you actually pointed out that in the maintenance stage, it's very important to keep following up on a regular basis. So do you also follow them up with the body composition and making sure that they can follow a plan, because this is more of a lifestyle change, right? For them, is not just a short period of time that, yes, that they should be successful, or you want them to be successful for the rest of their lives, right?
Yes, and I think that's, Monica, I think you put that really well. I think that's kind of the goal of any healthcare provider, allied health, even personal trainer, dietitian, is to improve the quality of health. And when you look at that in terms of even in the maintenance phase, which would be over 6 months, you also have areas that people, to make it a lifestyle, it's one of those things that you want to do for a period of time. So sometimes people may have relapses, and that's really important to be able to get them back on the right track and say it's okay, and be able to get back on track, and also to make that something that is sustainable. So something that they have to make sure that they've integrated into their life, and not only a change, but like you mentioned, a lifestyle. So it is very important. You may not need to have it as frequently in the beginning when you first see them, but at least following up, let's say even 6 to 8 weeks, or even a 3-month period of time for a follow-up.
That sounds very significant. Somebody in the audience is asking if you are still using DEXA in the clinic, and if so, how do you choose between using the InBody, which I know you have in there, and DEXA? Which one? How do you decide which one to use within the clinic?
So currently we use the DEXA for research purposes. We only use it for research purposes at this time. And we do the bioelectrical impedance, and we do circumference measurements as well. And we do that on a more regular basis because that is one of the body composition methods that we do have at the period of time.
Okay, sounds good. They're also asking in your study that you showed to us, do you utilize the Bland and Altman technique to look for possible measurements bias at the individual level?
Yes, I can look more into that. We did use the Bland Ullman plots to look at that, and I can provide some more detail on that after this. In the previous research that we had, and we do plan on our current research to use that as well. And I can provide some feedback offline if you'd like.
Thank you so much. So yeah, we'll provide your contact information that is on the screen so they can contact you. Also, I wanted to ask you, since you have really a wealth of experience using the InBody, and understand that loss of weight, just pounds, is not showing the whole picture. What parameters have you found that are more useful for people to see or follow up? And also, to add to this, you show an example with a person that lost 40 pounds, but I'm pretty sure you're encountering other, larger people that want to lose more weight than that. Is there a difference in what parameters you want to show to them? How you motivate them using other parameters, just besides you're just losing so many pounds of weight, right?
Yes, and Monica, I think that's a good point that you look at as well, because some of your patients that may be in the different categories of obesity, for example, if some people are morbidly obese, for example, that their BMI is over a certain amount, their body, like for example, their body fat may be way over than what is considered to be even the obese or the normal range. And so you don't want to necessarily keep it like disheartening when you're going over the different results, but you have it as something we talked about before, as having a baseline. The other thing that you can mention is it can motivate certain things, such as if you look at not only that body fat, but you can look at visceral fat. So if somebody is looking at their regular exercise routine, and they then follow up, let's say in 6 to 8 weeks, and maybe their body composition has decreased by 1%, and they think, well, I've been working so hard, I should have been like 10%, just throwing it out there. Mm-hmm. But let's say that their visceral fat has decreased a lot, and they're healthier, And they've also, since they've been exercising, they've maintained their skeletal muscle or have increased it. And so those are other factors that you can point to that it, even though it may not be a drastic change in terms of like getting to where they want to be, they are making progress. And so I think that's a key point that you make with patients, is that you focus on the positive and you focus on the progress, because getting someplace in terms of body composition, like we talked about before, it can be a little disheartening to when you see it or when it's not happening the way you want it. But if you can focus on like how you're improving health or how you're improving some things in your life, it makes it worthwhile. So there are different other functions you can look at. You can look at visceral fat, you can look at segmental analysis, but I would focus on giving the big picture and baseline and how you're showing progress.
Thank you so much, Mr. Combest. Also here, and I'm pretty sure you have some experience in the clinic. How does being on ketosis diet impact impedance measurement?
Oh, that's a good question. I will actually have to check back on that. But as long as I believe one of the things that's important, that is important to make sure that they are maintaining their regular water intake. But in terms of like how that would affect with weight and body composition, as long as they're maintaining other things like their exercise and their regulatory water intake, it shouldn't impact it as much, or it shouldn't impact as much as you would with other diets. I don't think it would impact it as much as long as they're keeping their hydration and their regular exercise routine. Sometimes with the ketosis, once again, that's more of less carbohydrates. I'm not sure the exact definition of what you're looking at a ketosis diet, but sometimes if the very low carbohydrate intake, sometimes it's harder to exercise. And so that's kind of one of the things that you look at if you're having the fuel for exercise, carbohydrate, and depending on, having a very low carb, some people can do with exercise, but depending on if you're exercise, all things being equal, that you're having the carbohydrate to exercise, that's something to consider.
Thank you so much, Mr. Combest. We really do appreciate you taking the time to talk to us today. We still have more questions, but we have limited time. So anybody that can contact you at the email. We're very grateful to you for sharing the tremendous work you're doing at Walter Reed and in your clinic. And to our audience, if you would like to reach out to Mr. Combest, please use the email shown at the top of the slide. To everyone who joined us today, we hope this was both informative and inspiring, and that you will consider joining us in future webinars. If you need to reach out to us, please join us at clinical@inbody.com. If you want to have a conversation with us about applications, or if you may be interested in sharing your work with us and other researchers or clinicians through this forum. Also, please contact us if you need a certificate of attendance to apply for CPU credits or CPE credits, if that applies to you, as we show here on the screen. And please stay tuned for our future webinar, which is going to be taking place on August 4th, 2001, which will be a presentation with Mr. Jousebos from the University of Southern California.